Hello everyone, once again welcome to my Oet channel. Today we will have Oet exam introspection regarding the writing letter which came on 17 December 2022 in some countries. As you know that nowadays there are different question papers in different countries, so it will not be same example. Maybe if you are seeing this video, maybe you will feel that I didn't write this question paper for my exam. So it will be different according to the countries. It can be different. And before this video I did another one introspection for the same day. It was Paul Shifton's letter. Actually this same question paper came during July 2022, so this is like a repeated question. And this question, actually I have only few information regarding the question paper. With that we will see the writing introspection. So this patient's name, actually it is not clear. I got only the surname, that is Ferrin, Mrs. Ferrin, and she is 84 years old. Actually this is a referral letter to nursing home manager. Patient is going to admit there from hospital. From hospital after surgery for follow-up care, we are sending this patient to a nursing home. And nursing home's name was also, I don't know, and regarding the reader also, I'm not sure about the name. Anyway, we will see with our available information. So this patient name is surname, I will tell you, Mrs. Ferrin, 84 years old, and we are writing the letter to nursing manager in nursing home. Then the main requirement is continued post-operative care. It's like a continued care, follow-up care or ongoing care, or we can tell it's like post-operative convalescent care. So whatever the terms, we can use it. So they have given the case note from 2014 onwards. This patient has had, they have given callus or bunion. But this patient has undergone bunionectomy. So we can write bunion. And patient was on hydrocortisone and analgesics, but there was no improvement over this time period. So her surgery was planned. Therefore, on 5 January 2022, she has undergone the surgery successfully without any complications. Post-operatively, actually, they have initiated physiotherapy, exercises, antibiotic therapy, antithrombolytic therapy, and for pain management they have given codeine. Then codeine changed to paracetamol, and that paracetamol have to be continued for 6 days. Moreover, they have given some advice regarding elevation, leg elevation with the help of pillows. And consequently patient has good progress and ready for discharge today. So as usual, today's date is 8 January 2022. And social paragraph, they have given that patient lives alone. She has one son, and this is actually like a planned, the surgery is planned. Actually bunionectomy, it is a planned surgery, and there is no one to stay with the patient after discharged to home. Therefore her son already planned this nursing home admission prior to the surgery. That's why we are writing letter to the nursing home manager. Then regarding past medical history, she has had osteoarthritis and hypertension. They have given the antihypertensive medication, but I'm not sure about that. Then the recommendation, actually they have given, they have to assess dressing, continue the exercise program. They have to issue surgical boot and arrange occupational therapists to assess the ability to live independently, because patient is keen to go home. And they have given the follow-up also, but the date or after how many days or weeks, it's not clear for me, but just in the sample letter I wrote 2 weeks. So this is the overall information regarding this case note. And once again, I'm telling that this information I got from my students. It will be vary and it will not be same like what you got during your exam. So there will be some changes in the original case notes. So until now we didn't get any official case notes and all. So with this one, actually this is a simple question, right? There is no twisting, there is no confusion, because from hospital after surgery straight away patient is going to nursing home. So there is nothing to be worried about this case. Now this is very simple question paper. So we will see how will be the answer, like a sample letter. So we will start with the date 8 January 2022, and the address as per the writing task you have to write. Here I don't have any idea, so I just wrote the nurse manager and the nursing home. Then, dear sir or madam, regarding Mrs. full name you have to write. I have only surname Ferrin, comma, aged 85. Then the introduction will be, we have to request what is the requirement. Then we have to write what is the current status. So I am writing to request post-operative convalescent care for Mrs. Ferrin, full name we have to write, who has undergone left bunionectomy. Okay, then she is said to be discharged today. So today is her discharge date. So we can write more. Other than that, you don't need to write anything here. I am writing to request post-operative convalescent care, or you can write continued care or follow-up care or ongoing care, whatever. For Mrs. Ferrin, who has undergone left bunionectomy, she is said to be discharged today. So that's all our introduction, and next we will move to the present medical paragraph. What I told you, the same thing, only I formulated like a story. Mrs. Ferrin has had, so in this type of question paper, I have to inform you that if they have given any old medical history related to our current condition, you have to mention here in the starting itself. And because this here, the bunion, it is important from when they have diagnosed and what is the management she has received until now. Then you have to go to the surgery. Okay, so we can start like this. Mrs. Ferrin has had left leg bunion since 2014 and was on hydrocortisone and analgesics. Gradually, on 5 January 2022, she underwent the surgery successfully. So that's enough. Post-operatively, then what all the management we have given. So she has been managed with, because antibiotics, analgesics, everything will be continued now. Because surgery has finished 5, today 8. Of course, there will be antibiotics and also I wrote has been because it's continuing. So post-operatively, she has been managed with antibiotics, antithrombolytic, then tablet codeine, followed by paracetamol. Okay, paracetamol followed by means first it was codeine, now it is paracetamol, physiotherapy, which need to be continued. So which needs means only one verb should be there. Here there are many procedures, not verb, many procedures. So we have to write which need to be continued. So everything have to be continued. Also, she has been advised to elevate her left leg with the pillows. That one also I advise. Then subsequently, she made progress and ready for discharge today. However, her son already arranged admission for her at your facility. Follow-up care at your service is essential until her complete recovery. So that is the main reason for the referral, because already they have arranged the admission. Now we are just giving them the information regarding hospitalization. That's also. Subsequently, she made good progress and ready for discharge today. However, her son, you can write here since also. Since her son already arranged admission at your facility for her, follow-up care at your service is essential until her complete recovery. So, because patient stays alone, that's why he arranged already the admission. Then next one we can go to the social paragraph. Mrs. Ferrin is retired who lives alone. We have given is retired also. She is retired also. She has had osteoarthritis and hypertension since that year also. So I don't know exactly the year when it got diagnosed. If there is no date given, you can just write she has osteoarthritis and hypertension as well as on medication. So they have given medication also. I'm not sure about that. Then the last is the recommendation paragraph. As I told you, it would be appreciated if you could assess Mrs. Ferrin's apostrophe S. Okay, because some of the students used to forget this apostrophe S. If you think in your mother tongue how it will be without apostrophe S means there is no meaning. So don't forget to write this apostrophe S. Ferrin's surgical site and dressing, as well as continue her exercise program. So you can connect a recommendation so that the letter will not be large enough. It will be concise manner and it is easy for you to get score also. It will be appreciated if you could assess Mrs. Ferrin's surgical site and dressing as well as continue her exercise program. Kindly arrange her surgical boot and an occupational therapist to assess her ability to live independently as she is keen to go home. So here surgical boot and occupational therapist, both they need to arrange. So we can write it together. The last thing is follow-up. Regarding follow-up, always just try to write please note, kindly note or off note. Off note is or double F. Off note, she has follow-up visit after this many days. So just I kept 2 weeks or 3 weeks or 1 month, something like that. So we can write or even after 5 days or something like that. So it would be appreciated if you could assess Mrs. Ferrin's surgical site and dressing as well as continue her exercise program. Kindly arrange her surgical boot and an occupational therapist to assess her ability to live independently as she is keen to go home. Off note, she has follow-up visit after 2 weeks. So this is the sample letter. So as I told you, this is very simple letter, and I don't know regarding the old history whether they have given any more social histories or past medical histories or any surgical history. If there is surgical history, of course you have to write because it is a surgical case. And there is no other subheadings and all. There is no second diagnosis, no second conditions, only bunionectomy, and we are writing the same thing only. So in this way, if you practice, it will be easy. One thing you have to remember, something if you have given, we provided to the patient means always try to write it in the formula. I will tell you the formula. Subject plus is or was plus has been, or is or was or has been plus V3 form. That means subject means he or she or patient name. Is means if it's happened today, you have to write is. If it's already happened, it's not continuing now, we have to write was. If it started already and we are continuing now, means has been plus V3 form. V3 form means what is that? Same like initiate means initiated. Same V2 form only will come. That means the past tense only will come. Prescribed, administered, commenced. If it is undergo means the past tense will be underwent. V3 form, that is the present perfect, will be has undergone. So only that is the difference. Mostly we can see it in Oet letter. Remaining everything will be same. V2 form only will come. So she has been advised for this many thing, or she was means it's finished already. She was commenced on physiotherapy means already physiotherapy section has finished, no more. If it is continuing means she has provided with physiotherapy. That means which needs to be continued. No need to write which needs to be continued. It's not mandatory always, but if it is there in the recommendation paragraph means you can write it here which needs to be continued. So no need to write the same sentence in your recommendation paragraph. So this is the formula for the easy passive voice in Oet. So if you follow this this formula, of course you will get B score, because many of students, they lose B score only because of this mistake. They used to write it in another one way. So it will not be suitable for our Oet letter. So I hope this letter and the introspection and the sample letter will be beneficial for you. We will see with another one informative video. Until then, bye. Take care.